Hello, this is Dr. Do again. This video is alphabetic list of problems, still on letter L, and I started to talk about the lung and structure and the lung diseases. On previous video, I talked about the very one of the most common lung diseases is pneumonia, and in terms of the pneumonia, there are different ways to categorize for adult, or usually just as community-acquired pneumonia or healthcare associate pneumonia. So last time I mentioned about the community-acquired pneumonia, usually most commonly caused by the strep or the plasma, and also some other uncommon bacteria, particularly is associated with other comorbidities like the immunocompromised or alcohol or liver disease or a chronic kidney disease. So those are the group of people had high risk. In terms of pneumonia, there is a risk factors for those older people with other comorbidities. And I mentioned about the symptoms. What kind of course, on top of all the bacteria causes, on top of that is the most common one, the viral. The viral cause of pneumonia. But what are the signs? I think I mentioned. Indicating the pneumonia is really serious and caused by the bacteria, has to be managed by the antibiotics under guidance from your physician. So I mentioned those signs. In general, it's the high fever cannot brought down, or long-term fever, or very sick in generalized. You want to feel malaise, feel tired and coughing, especially for those who have chronic lung diseases like asthma, COPD. If the coughing or the fever or associated with chest pain or not associated with chest pain or with change color, so that means really hypoxia. You need to see the physician as soon as possible or the emergency room. So today I'm going to talk about in terms of children in this community-acquired pneumonia. Children usually cause, of course, viral is one of the most common cause for children pneumonia, and the bacteria is different from the adult. Younger than 5 years old, usually caused by the Haemophilus. So that's the gram-negative compared to the gram-positive strep. So that's a different management. But on top of that, for men or for adult or for children, one of the most common cause actually are the viral. So those are the community-acquired. And there's another group of pneumonia referring to those occurred in the healthcare provider or recently hospitalized less than 6 weeks, for example, 4 weeks or 6 weeks, or living in the senior living facility or going to a dialysis facility quite often, etc. So those kind of group of people, if they develop the pneumonia, the causes or the pathogens might be different from the common strep. So there are different kinds, for example, the staph or the Pseudomonas even, or the other causes, or the gram-negative bacteria can also cause this pneumonia. So in terms of the general signs, they probably, because of the comorbidities, because of this age, because of this environment, so there are, in general, systemic symptoms may be more severe and may look more toxic. And also in terms of management, so for example, the Pseudomonas tend to infect those had a past history of the intubation or some other dwelling tubes or dwelling structures. So if that's the case, the management is really challenging. It's not like the community-acquired pneumonia, the strep, quite straightforward with the azithromycin, for example, and other medication. Depends on your physician's preference, depends on the culture. Usually, in terms of the diagnosis, the culture is not necessarily indicating you have it because the negative rate is quite high. It's not easy to culture to identify the bacteria, just empirically treat. So based on the history, so this is really the job for the physician, based on your history, tracing back, did you have recently hospitalization, or were you dwelling in the long-term facility, or anybody around you are sick, or are you immunocompromised? So these are the history really can already give the picture to the clinical clinicians that what kind of the bacteria might cause this pneumonia. In addition to the clinical presentations, those people had, since the comorbidity or since the pathogens are different, so the look more toxic and sick. In terms of treatment, probably get a broader coverage. In addition to this, probably use Levoquin, for example, have a stronger potency and also broader coverage. So the in general, the diagnosis for this pneumonia, of course, the blood test, you would be drawn blood to look at the cells and look at the lymphocytes, the neutrophils, and chest X-ray to see whether there are any markers for infection, and probably get some sputum if we have it to the culture. Like I said, the culture is really, if it is positive, of course, can indicate you have it. But if it is negative, cannot exclude that you have the bacterial infection. So really based on your physician's experience and also based on the patient's history. In terms of the risk of pneumonia risk, either community-acquired or healthcare associated pneumonia, really age group, like I'm going to mention again, age group, older than 65 years old, and also the past medical history, comorbidities like a chronic kidney disease, chronic liver disease, asthma, COPD. Those are the really all immunocompromised, like the genetic or viral cause immunodeficiency, or smoker, long-term smoker, really, especially for those, even the remote smoker, after age of 65 years old, really increase the risk of pneumonia and increase the severity of the lung infections, and also associated with other diseases. Since I'm talking about the pneumonia, so these are the risk factors. In terms of the severity of this pneumonia, or there's a very regulated, very well written guidelines based on your history, your age, and your other lab tests, like the blood gas test, for example, see whether you have hypoxia, whether you have acidosis. So these are very complicated criteria to score the pneumonia severity, whether you belong to very severe or belong to moderate or not very severe, and to guide the treatment. So anyway, the wrapping up, taking home message is for those either young people, less than 5 years old, because have different kind of bacteria. Sometimes can, and children sometimes cannot, like adult, to be managed in a way followed otherwise. So could be very serious. Go to your physician, the sooner the better. And for older people and those with comorbidities, if you have any sign of coughing, chest pain, hypoxia, particularly with some lung disease, pre-existing asthma, COPD, or any other systemic disease, go see your physician. Do not hesitate, especially in the high peak seasons, the early winter and late spring, late winter. So that's really the time for the upper respiratory infection can complicate it into bacterial pneumonia. So this is about the video, just wrapping up, talk about two types of pneumonia. In general, there are a lot of common aspects in terms of clinical presentation, but some different. So I hope it helps, and I'm going to stop here, and thank you for watching. I will see you next time.